Good morning. I'm Dr. Nicola. How are you? Good. Now, you've been referred to me because of your drooping eyelid. Is that right? Okay. Not to worry. What I'll be doing today is assessing the situation and seeing what is actually going on and if surgery is of benefit to you. Alright, okay. So I'm just going to check you in if that's okay, my love. So, can you confirm your full name, please? Okay, and your date of birth? Thank you. Okay, and can I have a contact number, please? Okay, wonderful. And can I have an email address, please? Okay, wonderful. And what's your occupation? Do you drive? Okay, wonderful. And what's your marital status? And your gender? Okay. Okay. Wonderful. GP referred you. Okay. Great. You're all checked in. Now I will be jotting notes throughout of the appointment. Then I will be writing it all up and sending you a copy via your email. Alright. Okay. So let me get my notes. Okay. So okay. So what I'm going to do first is just take a look at you. Alright. This eye is actually a lot smaller than the other. All right. And you are droopy up top, and it is covering your eye significantly. All right. Yes, which is why you would have been referred to me, especially because it is affecting your vision, and that's not safe or healthy. So yeah, so people come to me, we do a bit more of an in-depth assessment, and then, you know, go down the route of surgery if we need to. All right, but by my first observation, I feel like surgery is probably the only answer, but I do need to go into a lot more depth before we agree on that. Okay. Yeah. So by looking at you, you definitely have significant drooping of the left upper eyelid. So you definitely have ptosis, my lovely. Okay. All right. Okay. So right, I do need to ask you some questions, okay? So when did you first notice the drooping? 6 weeks ago. Okay, and what were you doing at the time? Okay. So you woke up, had a shower, got dry, looked in the mirror, and then noticed some drooping. All right. Now, did it look like it does today, or has it gotten worse? Okay, it's gotten worse. So it was only slight. Yeah. And then over the day it got worse and worse. Now, did it stay like that for a while and then escalate? Okay. Makes sense. Okay. Okay. So at what point did it start to become an issue? Yeah. Okay. Right, have they tested you for a stroke, Bell's palsy, or anything like that? Okay, and all okay. Good. Lovely. So I can see it's just the one eye. Has it always been the one eye, or have you had some issue with this one? No, just the left. Okay. Have you ever had this before? No. Okay. All right. So looking at your eye, it's very droopy. Can you tell me if it stays like this now, or does it get worse sometimes and then comes back again? Does it go a little bit better than this? Okay. So this is your standard now, and it's been like that for how long? Okay. Okay, so right, so it gets worse when you're tired. Okay. Okay. Now, tell me, do you get any pain at all? Yeah. Okay, so you get watery eye as well. Twitching. Discomfort. Would you say pain? Slightly. Okay. What about headache? Okay, so Get headaches more and sort of in the eye. Okay. So would you say a little bit of eye strain? Yeah. Now, I know this has been affecting your vision, so if you could just elaborate a little bit more how it's been affecting that. Okay, so... Okay, well, right. Yeah, so affecting you, obviously, reading, driving. Yeah, and you've been a bit clumsy, banging into things and that. So your peripheral vision is affected as well. Okay. Interesting. So, have you ever had eye surgery? What about facial surgery? Any eye conditions such as glaucoma or anything else? No. And any neurological issues? No. Okay. What about mental health problems? Okay, and are you on any treatment? Yeah, and how much? Anything else? And what do you take that for? Okay. And when was the last time you had a medication review? Right, okay, I'll see what GP thinks about that. The medications are okay, my love. All right, I mean, obviously side effects, you can get things like that, but how long have you been on these? Okay, so that's some time and you've never had this before, so the medication shouldn't be affecting it. Okay. Now, have you had any Botox or cosmetic treatments? Okay, and whereabouts, please? Right. Okay. When was the last time? Okay. I mean, yeah, after Botox, you know, we can get some drooping if it was injected incorrectly, you know, if something went wrong, basically. And it can happen at kind of any time. Usually happens quite instantly or within the first, you know, 48 to 72 hours. But in some cases it can happen just randomly, okay? Yeah, I mean, and where you've had the Botox, that possibly could have affected it, but you haven't had that done for 6 months, so I'm not too sure whether that is contributing to it. Yeah, okay. All right, okay. Right. Okay, have you got any like metal pins or plates or anything like that in your face at all? Okay. Any piercings? Okay, wonderful. Right, now, tell me if you've got any other symptoms, okay? It doesn't matter whether you think they're related or not. If you could just let me know and then I can write it down. Okay. Interesting. Your body's definitely not happy. Yeah, something's not quite right. Okay, I've asked you everything I need to know for now. If you do think of anything that you think is relevant, please let me know. All right. Okay. So I've done, obviously, facial observation. I've already done that. Okay. So I don't need to do that. I will be taking some measurements shortly. Okay. so we'll do that in a moment. Right, I'm going to get you to do a few little things for me, okay? So, if you could just raise your brows and hold it. Okay, and relax. And raise, down, raise, down, raise, relax. Thank you. Okay, now could you frown? Release, frown, release, frown, release. Alright, can you scrunch all your face for me? Relax. Okay, frown. Okay, relax. Raise your brows. Okay, relax. Okay. Now can you just smile for me? And a really big smile. Relax. I'm just going to observe you blinking normally, okay? So just don't think about it, just casually blink, alright? Good job. Okay, now can you try not to blink? Good try. Okay, and just blink normally. Okay, try not to blink. Okay, good try. Okay, now blink really fast for me. Okay, relax. It's definitely like struggling to keep up, isn't it? Okay, now when I say blink, blink. Blink. Blink, blink. 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 Blink, blink. 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 Blink, blink, blink. Blink. Blink, blink. Blink, blink, blink. 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 Perfect. Okay, now can you wink at all with either eye? Okay, so that side's totally impossible. You can do a little bit that side. Now can you wink normally? Okay. Now, can you try and open your eyes really wide for me? It's really struggling, isn't it? And close your eyes. Open them. Close. Open, close, open, close, open, close. Open. Open really wide for me. bit wider. And now blink, blink, blink. Can you try and wink? Blink, wink. Blink, blink, blink. Open your eyes really wide. Close them and relax. Okay, good try. Your eye area is all struggling and it's not keeping up very well. Alright. Okay. Now, close your eyes really tight. Okay, relax. Okay, I'm going to assess your eye movement. Alright, so just with your eyes, if you could look up. Down. And back at me. To your left. To your right. Now can you roll your eyes? What about the other way? Okay, and back at me. Now can you flutter your lashes? Okay, thank you. Okay. Okay, good. So what I'm going to do next is take some photographs now. Okay. Okay, let me check on the system. I think we might have to change the light a little bit, my lovely. It's a little bit flickery in here, I think. Okay, I might just turn that up a tad, okay? There we go. Sorry if it's a little bit brighter. I think that's much better. Okay, so that is all set up. So the camera is in place. Lovely. So what I'd like you to do first is just sit as you are. Okay, leave your eyes open. Okay, and close your eyes. Good job, and open them. Now turn your head that way. Back at me. And turn that way. And back at me. Good. Now can you pop your head back a little bit? Bit more. And back at me. Now down a little bit. A bit more. And back at me. Good job. Now I want you to open your eyes really wide for me and hold it. Okay, and relax. Good. Frown. Raise your brows. Relax. Okay, and smile. And smile bigger. Relax. Okay. Let me just check if they have come through nicely. Just perfect. Good. They are all taken nicely. Okay, so I've got those. Good. So what I'm going to do in a moment is actually assess your eyelid, alright, and just around your face, okay, but I will be popping on some gloves for that, my lovely. Okay, and then I'll be doing a little vision assessment on you as well, okay. Okay, great. So I am now going to get some gloves. You're okay, my love. Good. Right, is it okay if I touch your face? Okay, thank you. So what I'm going to do first is literally just have a feel around. Okay, now if you feel any pain, discomfort or any tingling or weird sensations, if you could let me know. Okay. Mm-hmm. Okay. Do you have any allergies at all? Okay. Yeah. I can definitely feel this side is heavier. Okay. Hmm. Okay. Okay, if you could close your eyes for me. So here is a little bit red on top of your lid, okay? A little bit of irritation there as well, where it's been probably rubbing and pulling, okay? And then the sweat getting in between there and that, okay? You can see it's quite watery and a bit gooey there. That side's fine. If you could open your eyes. Okay, so I'm going to pull down your eyes. And up. This side doesn't move a lot. It's very, very heavy, very rigid, very swollen. Okay. I'm gonna have to get my light and have a look. Your eyes are appearing to look dry, my lovely, as well. Could be a bit of from eye strain, things like that. Okay. Okay, I'm just gonna have a look. Now, with the light on your eyes, is it quite sensitive? Okay, I'm going to pull down. Oil and tear duct looks okay, but it's slightly dry. And up. Appears to be fine. Okay. Oil and tear duct does look okay, but it is quite dry, my lovely. Alright, now we'll try and lift this. I'm going to have to try a bit more, I'm sorry. There's a lot of irritation under there. It's very red. Yeah. Very inflamed. And I can see the twitching was going on as well. What's your sleep like, my love? Okay. Okay, close your eyes. Okay, open. Now I'm going to try and shut your eye, but I want you to try and stop me, okay? Okay, let me just feel along the lashes. Yeah, not liking that. Cover your eye. Just look straight ahead. The pupil reaction is definitely much slower as well, my lovely. Straight ahead. pupil's definitely much slower too. What kind of colour is this? Is it a cool light or a warm light? And what about this one? And which is easier for you to look at? Okay. Now, just with your eyes, I want you to look at my light and follow it. Okay. Follow the light, just your eyes. Okay. Look straight ahead. What colour do you see? And what colour do you see? Okay, so what colour is this? And what colour is this? And which is easier for you to look through? Good job. Let's take those off a moment. I need to write a couple of notes, okay, before we do a couple of other checks. Okay. Right, if you look at my nose, I'm going to pop my hands either side of my head and I'm going to pop different amounts of fingers up, and if you can just tell me how many you see, but you must stay looking at my nose. Alright. Okay, keep looking at my nose. I'm going to move either side and I want you to tell me which side you see. Okay. Okay, look at my nose. Tell me which side you see. Okay, keep looking at my nose. Okay, good try. Okay, now I know this is a little bit far back, but can you read anything? Give it a go for me. Okay. Okay, cover that eye and try again. Okay, now cover that eye and try again. Okay, good job. What colour's that? That. Okay, what shapes are these? Okay, now I want you to look at the eye chart and read as far as you can for me. Okay, cover that eye and read as far as you can. Good job. Okay, now cover that eye and same again. Good try. Okay, relax. Now tell me, how does it appear? Is it quite blurry or is it clear? How about now? Now, okay, cover that eye. Tell me, blurry or not? Blurry or not? Blurry or not? And swap eye. Blurry or not? Blurry or not? Blurry or not? Good try. Thank you very much. It's definitely affecting your vision. Do you normally wear glasses or contacts? Okay. Yeah, your vision is definitely impacted. And your peripheral vision too, my lovely. Okay. Okay, what we need to do now is raise your brows. Okay, and tell me if this looks blurry or clear. Okay, and frown, blurry or clear. And relax. Okay, thank you. And I want you to raise your brows and look at my nose. Do I appear blurry or clear? Frown and keep looking at my nose. Do I appear blurry or clear? Okay, relax. Now look at my nose. I'm going to put fingers here. Okay, can you see how many? Okay, and how many? How many? Okay, now frown. Tell me how many. How many? Okay, and raise your brows. How many? And keep them there. How many? Relax. Okay. Was it harder to see with your brows raised? Or was it clearer? Okay, thank you very much. Okay, great. So that one there, that's done. Yeah. So with this eye as well, the creasing is starting to shift slightly, all right, on the eyelid, which is pretty common in this instant. Okay. Right. Do need to take some measurements. All right. So double check that. Right. Okay, that one. Okay. Right. So you would benefit from the surgery, my lovely, okay? So we'll need to repair the ptosis, all right. Blepharoplasty, ptosis repair. Okay. Will need to be done to get your quality of life back, my love, because I am concerned as well that it's going to keep drooping and you're going to have it permanently closed, and well, we can't have that, so we need to nip it in the bud now before it does get any worse. All right. Okay, yeah. It's the only way we can get this solved. So you've got obviously the significant drooping in the upper eyelid. You have the reduction in your vision and upper visual field, and compensation by brow rising, and definitely suitable for the correction. Okay. So, are you happy for the procedure to be done? Okay. So for that, I will definitely need to take some measurements. All right. Now I can do all the marking up, etc., just quickly with the measurements, but you will need to come back in for a pre-op, all right, just to make sure that you are well enough for surgery. All right, and then we can go through everything then, like what to expect and things like that, but you can do a little bit of googling beforehand and just look into the procedure. All right. Yeah, so good. And then afterwards we will obviously need to make sure that your vision is okay and that your muscles are working fine and that your feeling's fine and things like that, okay? Yes, what I would probably do, I would check over you to make sure obviously that everything was fine. And then I'd probably get you in for a neurological assessment or something like that, focusing on your nerves and your muscles in your face. Okay, yeah, I think so. Yeah, that would be after the procedure, after you've healed a little bit. I will have to conduct a couple of assessments just to see if your face is functioning as it should do and that you're feeling everything fine and things like that. Okay, but that will be later on down the line. So the next step would be, I'm going to take some measurements, do a bit of marking up. All right, then I'm going to get you in for a pre-op assessment to make sure you're fit enough. Then we'll do the surgery. All right, and then I will have a follow-up appointment to make sure that everything went okay, etc. Then later on, then we'll be assessing your function with your face movements, sensations, and all that kind of stuff. Okay. How does that sound? Good. Hopefully we can get all this done and dusted for you within the 6 months. All right. Obviously, I'm allowing for recovery time and all that as well. Okay. Good. So we are happy to do all that. So what I'm going to do now is just do a couple of measurements. Okay. Okay. Can you just raise your brows? And relax. Raise your brows. Relax. Okay, I'm not going to take any more measurements, okay, because I will do that a little bit more if I need to on pre-op. Okay, so I'm going to use a special pen. Okay. Close your eyes. Okay. for that to load back up. So I can take a couple more pictures. Okay, would you just raise your brow for me? Okay, and with your hands, if you can just keep your eyes shut and lift for me. Thank you. Okay, stay like so. Okay, close your eyes. Turn that way. And that way. And back at me. Good. Wonderful. Let me just check those. Great, they look perfect. Okay, that will just wash off, my lovely. Okay, so I've marked up where it needs to be done. All right, so we can remove the skin here and lift it up and pin it and stitch it into place, basically. All right. Okay, do you have any questions? Okay, you've probably got lots of different things going on in your head right now. So I'm going to give you a couple of things to do. Okay, so here is information on the treatment that I'll be carrying out for you. So if you can see here, you've got all the steps and things that I'll be doing and what it involves. Okay, but if you do have any more, concerns and things like that, you can ask me, but also do a bit of research and look into it. This is obviously the basics, and everything that you need to know is here, but if you want to dig a little bit deeper, then please go and do some research. And unsure about anything, please contact me and I can happily help. All right, you are very welcome, my lovely. Now, what I will do is I will contact you with an appointment, a date for surgery, and then I'll get you in a couple of weeks before when we can do a pre-op. All right. Yeah, it'll probably be the nurse that does the pre-op, my lovely. They'll be going through any questions you have. They'll be, making sure you're all fit and well for surgery. All right, and then you'll come in, have the surgery. You'll be able to go home the next day, as long as everything is fine. And, we can carry out the rest of the checks a little bit later, and hopefully everything's working as it should. All right, but soon enough, you'll have your eye back and you'll be able to, see what's what. But what I will do, my lovely, I'm going to get some eye drops sent to your chosen pharmacy. Okay, treat for dry eyes, a little bit of lubricant to help that. And I'm also going to give you some anti-inflammatories as well, my lovely. Okay, just to help any swelling. Okay, wonderful. Give that a day or so and hopefully they should be ready. All right, but that is everything for today. I know it's been quite a long appointment, but unfortunately these sessions are very long. I have to make sure that I'm happy with everything before doing, obviously, the surgery. All right, it was lovely to meet you. I'm sorry in these circumstances, but soon enough you're going to look and feel incredible, and you're going to be able to see. All right, now take it easy, please don't stress, and we'll soon fix this and we can go from there. Yeah, we can look into things a little bit down the line, and I would definitely contact the person who did the Botox and just have a word with them. All right, my lovely. You're very welcome. You take care now. Bye-bye.